Hello friends, I am Dr. Kunal Das. I am Head and Consultant Gastroenterology, Manipal Hospitals, Dwarka. I have been trained in gastroenterology from the famous G.B.Pant Hospital under Dr. S.K. Sareen, and I have done my undergraduate and post-graduation in medicine from Maulana Azad Medical College. Prior to working in Manipal Hospitals, I was working for the last 11 years in Max Hospital, Patparganj and Vaishali. And I was also working with Fortis Noida and Sir Gangaram Hospital in Delhi. My major interests are in endoscopic ultrasound, endoscopic procedures, advanced endoscopic procedures like ESD, which is endoscopic submucosal dissection, EMR, which is endoscopic mucosal resection, and ERCP, which is endoscopic retrograde cholangio-Pancreatography, which is a kind of endoscopic procedure to remove from the stones and cancers in the bile duct. Gastrointestinal tumors are a very important component and cause of mortality and great morbidity in our population. There are many pockets of areas where gastrointestinal tumors are very aggressive, and they are in one of the most highest incidences in the world. These days, gastrointestinal tumors are also treating endoscopically. This is important for early gastric cancers. It is very important to diagnose them very early so that their treatment is endoscopically. Endoscopically is the biggest advance in the last 2 decades for the treatment of gastrointestinal tumors. This is because the tumors which are diagnosed by endoscopically and treated endoscopically, patient do not undergo a big operation, and so that this patient not only undergoes a smaller operation, a scarless operation, but also gets discharged very early from the hospital so that patient can be with their family, and morbidity is very less with such kind of tumors. But for this kind of tumors, it is in a very selected group of tumors where the endoscopically we find that the tumors are very early stage tumors and they have not spread beyond the stomach wall and to the lymph nodes. These days we have very advanced endoscopic imaging possibilities through the endoscopes, where we can see endopathology. By seeing the morphology of the tumor as well as their pit patterns, we can make an assessment of the fact whether this tumor can be taken care of endoscopically. We have various procedures like endoscopic submucosal dissection. We have procedures like EFTR, which is endoscopic resection of the wall for these tumors, and these are the biggest advantage of such tumors or taking out endoscopically is that patient can go home in the next 24 hours. This is the biggest advantage. Patient doesn't have a big scar, patient doesn't have a big mortality or morbidity, is very less compared to the surgical resection of tumors. But for this we need help of our patients, so that whenever they have any symptoms of gastrointestinal symptoms like dyspepsia or some amount of weight loss, they should be able to reach the doctors early so that doctors can investigate them and try to diagnose them early. It is only possible then. The mool mantra of cancer is diagnose early and treat early. That's when we can save lives. So this is a very interesting study where people who had taken only 1 or 2 cups of coffee, their incidence of gallbladder stones was reduced by only 4%. So the more number of cups of coffee you take, the greater is the reduction of gallbladder stones incidence in the population. But gallbladder stones presence or absence doesn't matter, because it is when it causes gallbladder stones causes pain, then we have to treat, then we have to get surgery done. So one must also think that coffee may have many other good uses also, but may also have bad uses also. Many of the patients say that they have gastritis or many other things which are linked to increase of coffee. So please take coffee in moderate amounts. Well, we are very positive about the home remedies because we have this dadi maa ke nuske for which are coming from very long. They have good traditions. All those dadi maa ke nuske are not to be trashed in the dustbin, but they may have certain good things about them. So we must accept them scientifically, and also we must be positive about the community we serve because it is community information. Some of this information are really useful. For example, if somebody has diarrhea, to take rice water, dal water is a good thing to happen. So we do not trash all them. Yes, India is a community, so many of the family friends are always giving advice, some other. But my viewpoint is that whenever you have a problem, please take those suggestions. Try to do for 2-3 days. But if you are relieved, okay. But do not refuse medical help or do not refuse to go to a medical opinion to get your problem solved. So pancreatic diseases are a lot of population have them and they are very difficult to treat. We have a lot of people taking alcohol, which causes chronic pancreatitis. Chronic pancreatitis is one of the most difficult things to treat because patient has a lot of pain and there is no permanent treatment. So the pancreatic treatment includes both enzymes, endotherapy, ESWL and surgery. So we have to utilize our endotherapy in the right manner for the appropriate patient. So when we get any patient of pancreatitis, we sit with our surgical colleagues and the radiological colleagues to plan out a proper map of treatment for our patients. So whenever patients have endotherapy, we do ERCP, or which is known as endoscopic retrograde Cholangio-Pancreatography. In this test, after sedating the patient and giving them general anesthesia, we introduce a endoscopic tube which has a light and a camera attached to it. This is a special tube which is also known as side viewing endoscopy because the camera is on the side of the tube. It goes and sees the ampulla and we are able to cannulate the pancreatic duct. After cannulating the pancreatic duct, we are able to see the contour of the pancreatic duct on a fluoroscopy or X-ray machine by using a dye. Once we know that what the patient is suffering from, whether there is a pancreatic stricture, which means that the pancreatic duct has a stoppage in between or a stone, depending upon the same, then we plan out a procedure and of treatment for him. We have all the modern accessories like pancreatic balloons, pancreatic stricture, pancreatic dilators, so that we can take care of our endotherapy of pancreas. It is a very fulfilling procedure because the patient is really relieved of pain. Also, we have introduced a new technique, especially for chronic pancreatitis, those who have to take a lot of pain medications. We have, which is known as endoscopic ultrasound guided CPN or celiac ganglion neurolysis. This is a very advanced and specialized test where we use another advanced endoscope, which is known as endoscopic ultrasound, to introduce into the body, and from the stomach we target the celiac ganglia, which are the nerve stations, and try to lyse them using alcohol and local anesthesia so that the pain is reduced. This is an absolutely new treatment and this helps our patients very long so that they can have and enjoy a pain-free life with that disease of chronic pancreatitis. So all these things are available in Manipal Hospital and we are doing in a routine manner. Thank you. Inflammatory bowel disease is a group of diseases where there is an autoimmune disease where the body is inside lymphocytes. Lymphocytes are cells which are army for the body, which help the body to fight the infection, external infection. But sometimes what happens is lymphocytes start damaging the intestine of the body, so it causes inflammatory bowel disease. So this is a very disease which was used to be thought that only the Western people have this disease, but these days, because of our change of stress and Western culture, so we are finding more and more patients diagnosed of this disease. The major symptoms of the disease are blood from the anus, mucus, loose motions of more than 2 weeks duration. So most of the times our patients believe that the bleeding from the stools is due to piles or hemorrhoids. They do not take proper care and try to ignore those symptoms. My request is to all people who have bleeding from the stool, please go to the hospital, go to the medical doctor, and please refer your case and get a simple procedure done, which is known as colonoscopy. And this is a very disease which can be easily controlled with medicines. The only thing is that patient may be aware and has to go to the medical person. So whenever a patient comes, we try to motivate them, try to give them the insight about patient education about the disease, and this is a disease which can be easily be controlled on medicines. Further, we also endeavor to give patient education about the disease. This disease usually is damaged by either infection or tension. So we try to educate the patient about the disease process as well as the patient about their own bodies so that they can take care of their own selves. We are also having a campaign where any bleeding PR patient, we try to educate them, try to motivate them, try to get the endoscopies and colonoscopies done in the population. Most of the Indian patients have a lot of fear of doing the investigations, especially colonoscopy, because they fear that they may be damaged and they have a lot of anxieties. So this is a very, very simple test. So it is that common a test and that important a test, so that anybody who is above 50 gets a colonoscopy in the USA every 5 years. So it's not a test to be feared at all. And this is a test we need not even admit the patient. The patient comes, gets a test done and goes away within few hours of the patient getting the test done. And patient can join back his or her routine activities the very next day. So it's a very simple test and it's a very simple disease to diagnose and a very simple disease to treat. If the patient is not being treated well, patient loses blood, so patient becomes anemic and a lot of complications happen due to anemia also. Patient loses a lot of mucus and stool, so patient has electrolyte imbalance, loses a lot of protein. So the patient loses a lot of weight. That is very distressing to the patient, which can be simply be treated with a procedure called as colonoscopy. And there are 2-3 medicines which can almost control the patient in a very common way. One other problem is patients in India do not want to take medicines for a long time. They think that we must have a definite 3-month therapy, and the medicines are so beautiful, the patients are so effective that patients think that I don't have disease and they stop the medicines also. That is another problem with our patients, that we try to educate them. But eventually what happens is, when you stop the medicines, patient is alright for 1 or 2 months and the patient disease recurrences again with the patients. So we try to tell them. What happens is, patients that do not want to spend money on the medicines, they have a problem in taking 3, 4, 6 medicines in a day. So now there is a further advance in the medicine, and there is something called as a sustained release form of mesalamine, and you need to take only 2 medicines, one tablet in the morning and 1 tablet in the evening, and that will control your disease in a very beautiful way, and your lifestyle will be very, very good. So my request to all patients is, if you have blood in stools for more than 2 weeks, please visit a doctor, medical person, and get your colonoscopy done, get it diagnosed, and it will be cured very good, and your social life, your education and normal routine life will absolutely be normal, and you will be like a normal person. Thank you. So we know that fatty liver disease is a very, very large and important disease problem for India. India is a disease capital for diabetes. There are many patients who are thyroid patients and who are obese in general, have lot of belly fat in these patients. So they have lot of fatty livers, and when the fat in the liver damages the liver, it is known as NASH, NASH, or non-alcoholic steatohepatitis. This means the fat in the liver damages the liver in the same manner that the alcohol damages the liver, and it causes a lot of liver problems and liver cirrhosis. So this is not a benign disease. But interestingly, there are certain patients, most of these patients are obese and overweight. But there are certain group of patients who are not obese, they are lean, and they have fat in the liver. So this is known as lean NASH. So these are the patients who are not overweight but still have fat in the liver. Still that fat is causing damage to the liver and causing NASH or non-alcoholic steatohepatitis. So this is a very unique thing which is very common in India, and we find that more and more patients are coming. The reason for this are many. There may be some have a metabolic syndrome which may be causing them not to get fat, but still the fat is deposited in the liver. They may have something what is known as insulin resistance, IR, which can be again the whatever food you are taking, that is because of the insulin resistance, that is not getting converted into active body compounds, but is getting converted into preferably into fat and getting deposited in the liver. Or there may be certain genetic disorders in the people, in patients in which they are whatever food they take, that is preferentially been gated into forming fat and getting deposited in the liver. However, what is the solution? However, there are no easy solutions. You still have to take good adequate care. You have to take regular follow-up with the doctors is warranted. Regular investigations is warranted. A simple ultrasound, a fibroscan, and a regular liver function test, evaluation test need to be done. There are simple, very oral drugs which need to be taken so that you can take care of your liver. This is a very interesting question, and we have found a lot of information. A lot of people have believed on homeopathy. Unfortunately, the medical regulations from the Western countries, especially the USA and UK, they think that homeopathy is useless. My take is that this homeopathy has there in India for a long time. There may be certain useful things in homeopathy. Many people do believe that homeopathic medicines are useful in liver diseases, but I do not believe them. I believe in my own pathy, and if patients want to take homeopathy, they are liberally to take this at their own risk.